eGlobalDoctors is a mobile and web application which provide telehealth services.
मीन टाइम जैसा कि मैं कह रहा था कि इस समय में the people are stepping up selflessly to help the folks in India. कई लोग रात भर जाग के they're calling friends in India to arrange for beds, arrange for oxygen, etc. तो आज का जो हमारा शो है उस शो में we are talking to two different people जो इसी तरह की सेल्फलेसली काम कर रहे हैं टू हेल्प द पीपल इन इंडिया. तो सबसे पहले मैं बुलाना चाहूँगा हमारे स्टूडियो में द मेंबर्स ऑफ eGlobalDoctors.com. और eGlobalDoctors का नाम आप सब ने सुना होगा क्योंकि इट हैज़ रियली स्प्रेड लाइक वाइल्ड फायर. व्हाट्सएप पे काफ़ी फॉरवर्ड्स हुए हैं. इवन द वाइस प्रेसिडेंट ऑफ यूएस कमला हैरिस हैज़ mentioned eGlobalDoctors. They have been mentioned in Times of India. They have been mentioned on various news channels in India. और ये इसलिए है क्योंकि eGlobalDoctors, which is an established business in US, जब उन्होंने देखा किस तरह से India is struggling with the time of physicians availability to help the patients in India, they realized that they can utilize this platform, the digital platform, to reach out and help out the folks in India. तो मैं स्वागत करना चाहूँगा हमारे इस प्लेटफॉर्म में members, the CEO of eGlobalDoctors, Krish Manchala. Krish, how are you?
I'm doing good. How are you, Rajiv?
Doing good.
Thanks for having me.
Thank you so much for joining us on today's show. I do want to talk to you a lot about the good deeds that you're doing, but let me also welcome Dr. Srini, who is joining us from eGlobalDoctors. Hello, Srini. How are you?
Rajiv, how are you?
Doing good. And Dr. Amrendra is also joining us. Hello, Dr. Amrendra. How are you?
Hello. Hi, Rajiv.
So first of all, I really want to thank you guys. You guys have been amazing. I had an opportunity to go into eGlobalDoctors.com and log in through Zoom in the evening and see the actual interaction of patients and you guys. And doing this job selflessly, I think you guys have come as angels for many patients in India. So first of all, thank you so much.
Thank you.
So Krish, who is the CEO of eGlobalDoctors.com. So Krish, please help us understand what eGlobalDoctors is and also an introduction for the team that you have here.
Sure. Thanks, Rajiv, for having me and my team on this epic live. Can you hear me? Yeah, hear me clearly?
Yeah, I can hear you. Yep.
Yeah, okay. I was just trying to see. I was hearing some echo as such. 1 second. So basically, we are a team of almost 7 people who have started this eGlobalDoctors idea as such. Our idea is to connect people from all over the world to the doctors in US, UK, and Australia, New Zealand to give all the best medical services to the customer. That's how we started. It's been more than 1 year we have been working on this product. And like you said, right, the pandemic time has come to India and the second wave is really harsh. So our doctors, Dr. Srini Gangasani, who is let me introduce my doctors and then we'll go into the details as such.
Absolutely.
Dr. Srini Gangasani, you can go ahead.
Hi everyone. Thank you for having us. My name is Srini Gangasani. I'm a cardiologist in Atlanta. I'm also very active in our association, API, which is American Association of Physicians of Indian Origin. I was a board of trustee there. I was a chair for the convention and the Global Health Summit. So I think as Chris said, I think we all treated our COVID patients, our families, our friends through WhatsApp messages. So when this second wave came, we all were like, we are ready. We have a platform. We should be able to help other people like what we are helping our friends and family. So that was the idea. And then we started it. I think we know we're doing a little bit like a drop in the bucket, but I think each drop adds up to make it the bucket. So I think we wanted to do our share. So that's what we started to do, and I'm glad we are doing it. And I'm glad so many volunteer doctors came forward to help along with us. Really appreciate all the doctors' help in this the COVID pandemic time.
That's great. And I would like to introduce Ritu, who is my co-host here, RJ Ritu.
Hi.
Hi, Ritu.
Hello,
Hi.
everyone. Welcome to
Hi
show.
there. Thank you.
Thank you, Rita.
And
Dr. Amar?
Hi, I'm Dr. Amarendra Kasala. I'm an anesthesiologist and interventional pain management doctor. I live in Lafayette, Louisiana. As we said, we started this as mostly for second medical opinion and a further care. We are supposed to open this site for open like end of this month, but because of the COVID, we open for free for all the people. As Srini said, we are doing our best, but there's a lot of patients and need more help than what we're doing. So hopefully we can survive as US survived through this last year. So I think India can do it too. So as with all our help, I think it should be okay.
Okay, and
and
how? Okay,
sorry, go ahead.
Rajesh. Yeah, I was just like saying how people can reach out to you. I know a lot of people in India need help, so how they can reach out to you guys?
So we have this
Uh,
eGlobalDoctors.com. I think if you go to www.eGlobalDoctors.com, we made it so simple that on the landing page we have a join button. So if you
Okay.
click on the button, you come into the waiting room. So we have volunteers waiting there, speak multiple languages. So our host will ask what kind of language the person speaks, so that they will put it into a breakout room. We need to have the privacy of each patient have their own way of doing things and where the personal problem. So the volunteer takes them into the one breakout room, and there is a form developed by one of the CDC physicians. So we use the form to fill out so that we can get all the data when the patients started to have the symptoms, what medicines they are on, what kind of lab they have done. So we have all that information on there filled out by the volunteer, usually who speaks the same language. And then we find the doctor who speaks the same language in the waiting room. We all will be waiting in the waiting room. So usually what we do is we put, like what I put my name as Dr. Srini, it says Dr. Srini, Telugu, Hindi, English, so that my host can identify, okay, this doctor can speak the same language as the patient,
Wow.
and move the patient and doctor into the same room, so that we can go talk to the patient and then evaluate on what we're doing. This is more counseling and advice, more so than a consultation, because I think that these people, they're living in their own isolation because of the COVID. So they're gonna, when you understand, when you're in your own room, in a small room, not talking to anybody, you can go crazy. And then with little symptoms, not knowing what is going on, with like 3 episodes of coughing or a little bit more fever, they look at, oh my God, I'm getting more symptoms, and they rush to the hospital.
Right.
By doing this kind of activity, by talking to the patient, reassuring them that, hey, there is no problem, you're okay, check the pulse ox, check the heart rate,
Right.
and then reassure them that they're doing good. So that's I think we wanted to get them. And also can decrease the burden on the people, the doctors who are working very hard in India, and they're not able to provide all the services, to everybody. They're burning out. So our goal is to give them the help while they can take some rest while taking care of these patients. So once the process is done, we have a form that we fill it out, and we'll advise whatever we need to give, so that they be reassured. And we also need to identify if somebody is really sick, so that they can go to the hospital. So we want to use the timing to reassure the patient if they're not very sick, stay home, and what they can do at home, so that they can just get away from using the resources outside in the ER or the hospital beds. But if they do need the patient, it's sick, they go to the hospital. That is our goal.
So, Dr. Srini, we always knew that doctors are another form of angels, because you guys come in, cure, provide the support, also provide motivation during these kind of times. But you have taken the word of angels to even to the next level, because the kind of things you guys are doing is really selfless help. Because from 7 to 10, when it's a family time and people are spending time to go out hiking and things like that, you guys are getting onto Zoom and talking to the patients in India. What drives you? What drives you to say, you know what, I really want to do this thing on a day-to-day basis, and it's not monetary or anything, it is your feeling. So I want to hear from one of you guys on what really drives you to do this.
Thank you. I think we do a lot of charitable work. Like all the physicians, what we want is the patient or the person we're giving the advice to be better, right? So I think that gives us that euphoria, whatever you want to call it. I think when you do it, sometimes I do it for myself. I run a free clinic in Atlanta, We have a free clinic we are running for the last 10 years through our Indian Physicians Association. Now, sometimes these people come in, they haven't seen a doctor for years and years, and they have so much gratitude when we take time to spend with them and give them what they need. I think I do it for myself. I feel good at the end of the day that I helped, and I feel that good feeling. I do it for that.
Yeah, and not only that, like, we build this product, which is a global product. We built a telehealth platform which can support up to 7.4 billion people. Means we have taken into the consideration of all the people of the world. Now, this is the time to go and help India. And you'll not believe, in last one week, 7 days, we got 99,000 users logging into our site. That is huge. We're not trying to sell any iPhones, or we're not a restaurant, we're not a retail stuff. It's a healthcare, and having 99,000 people coming to our site shows a lot of things, right? Like there are COVID issues in India.
Yeah.
A lot of people, there's a lockdown. People cannot go out freely. So there are no beds, as you know that, right? And a lot of anxiety in people's mind, So like, we are only open from morning India timing 6 to 9:30 a.m. But if you see our site and the people coming into our site, they're coming throughout the day, So we are trying to increase our timings from 6 to 12 noon, so that more Indian citizens can take advantage of this. It's absolutely free of cost. All you have to do is come to www.eGlobalDoctors.com and then click on the Zoom and talk to our doctors.
Wow. That's a big help for someone who doesn't have any relative or someone to take care of, and symptoms are just mild. At least you can take care of all the anxiety and just tell them that you are okay and you can stay home and you don't have to that's a big help for someone who is by himself.
And also, I'll tell you. Go ahead,
yeah, that's what we are trying to do, is reassure these patients so that they don't flock into the ERs or which are already overcrowded, or the hospitals are. And if we can do that, I think the hospital can keep up with the pace, and just a break in the cycle. All these things will help a lot in the long term.
Yeah. So basically, you're not helping only the patients, but the medical system there also, that you are taking care of all the anxiety, and the people who need actual help, they are getting it.
That's right. That's our basic purpose. Yes.
And also, not only Indian citizens, a lot of Indian Americans living in US are taking advantage of it. The people from here calling, their sisters are back home in India, mom and dad are in India. So they're calling the Zoom call. All are joining the same Zoom call. And all the family members are going into a same doctor's call. So they're discussing among family, one family to a same doctor. So, and getting the counseling. So that is the beauty of it. So almost around 40,000 users have logged in from US into our site.
What advantage of our platform is, so you can have the same person, family. So I can join from here. My brother can join from India. Another brother can join from London. We'll be on the same time talking to the doctor. As you know, when we talk to the doctor, even my mom had some health issues last year. She goes to the doctor. I call her, and she doesn't know what exactly the doctor said. I try to call the doctor, and then he's busy with other stuff. So it's so nice to have the doctor, patient, and family all at one time on the platform, so that way everybody gets their questions answered. I think that gives the lot of anxiety relief for the patients and the family when everybody's on the same page. So that is, I think, one of the beauty of our platform is it all at one time. They can come on, talk to the doctor, get the answers, and then get the treatment, whatever they need to be taken care of, and then go.
Yeah, actually last week मेरे friend के dad ventilator पे थे. All the vitals were dropping. The family has to take the call that whether to take him off the ventilator. So if there's a help like आप जो लोग दे रहे हो, तो like you can just tell the family that what kind of decision they need to make.
Right. No, and especially hard times, right? I'll give you an example. There was an Indian American from here who logged in to our site, and she was saying that her mom is in the hospital, her dad is at home, nobody to take care of it. It's very tough time. And she was literally crying on when talking to us. That kind of feelings. People cannot travel to India. They cannot come to US. So a lot of travel barriers. I think this is helping. This platform is helping a lot of folks.
So the platform is called eGlobalDoctors.com. Or Krish, I think after this show, the people who are watching the show, they all will be going like, wow, this is great. We want to use this platform. We can, the way you're saying that someone's relatives is in India, is in US, and all connecting together. So do you see this thing kind of overpowering you guys, overwhelming you guys with the volume of requests that may come up?
It's definitely right. But see, what we are trying to solve the pain points, right? I was giving example, like we all Indians living in US, our parents come from India, right? They come from India, they stay for 6 months, and because they are old, they get fever, they get a lot of small issues. For those aspects, they have insurance, they have travel insurance, etc. But going and identifying a doctor is becoming a pain. I don't know. I don't even know. Even though I'm an American citizen here, I don't even know where to go. I have my personal health care. I go to my, let's say, Kaiser. I go to my healthcare assistants. But for my dad and mom, when they come, it becomes difficult.
Right.
I go and take some advice, which I'm not satisfied. They are not satisfied. And they say that, okay, let me go back to India and talk to my doctor and get their advice. So we are waiting for 6 months, talking over the phone, etc. So that's a lot of pain point issues. All these issues will be resolved now, right? Imagine like you are in United States, you go to travel to Europe or India. If something happens to medical issues, you're stuck there. You're depending. You're trying to find out where to go. You talk to your family members, etc. कि कौन से hospital में जाके आपका इलाज कराना है, आपको पता ही नहीं चलेगा, right? So this platform has a lot of doctors. A lot of people can come to our site, do a research of the doctors, what kind of doctors, how many years of experience they have, etc. And then they can choose the doctors they want and then go and look at them.
The goal is to connect with a compassionate doctor who, like us, we want to connect the group of doctors who work like us. So we don't want to take anybody come on the platform and do it. So we want to connect the people like who can treat people like us. And also the one other advantage of our platform is what we call a health passport. So all the data for the patient, you can store it on the site and it be on the phone in your app. So that if I'm traveling from here to India, all my data is already there. My labs are there. If I had a CT scan, it's all there. If I had an angiogram, it's already there. So the data is carrying with you. So in the United States, my primary care doctor has all the data. And so now when I go to my primary care doctor, I get a copy of it. I can scan the picture. It goes into the eGlobal Health Passport. So when I'm traveling, I don't need to worry about, hey, where's my last cholesterol? Where's my last creatinine? So all will be with my last EKG. If I have an EKG, I need to have it in India. I can show them this is my old EKG. So this is my new EKG, so that we can compare to. So that health passport, which I think we are carrying it all the time. We may not have a spouse with us, but we carry our phone everywhere. So having the phone will give us all the information what you need, so that you can provide the quality care for the patient. So I'm a cardiologist. I see a lot of patients. So if there's an EKG, I always tell them, hey, take a picture of this so that you can store somewhere. But they take a picture and then a year later, 2 years later, they got to look at it. Okay, where is my picture? I can't find the picture.
Exactly.
Yeah. So with this platform, you can just use it, and wherever you are, you may be in London, you may be in Australia, but all your health information is with you. And you have a group of doctors you can contact from anywhere. So we'll connect the correct doctor for a correct patient, so that ultimately bottom line is to provide the quality care to the patient.
Exactly. So there's a question, Chris. Do you have any doctor from India in team on your team?
Yes. I was looking at the question. Yes, we do have a few doctors registered from India on the team right now. This for the COVID-related issues. Yes, they're registered.
Perfect.
So we were rapidly expanding. So initially we wanted to start, as I think Dr. Amar said, we wanted to do the end of the month. So we just started talking to the doctors, and we didn't want to take anybody. So as I said, we wanted to be a referral-based kind of a doctor group. So if I have a doctor who I trust, if that doctor says this is a good doctor, that is the doctor I want. I don't want anybody to just say that, hey, I want to join the team, because the team is as good as I think all other members are. So we want to make sure that we have a great team, so that we want to provide the best care available out there.
Exactly.
We are also working with other team of the group of doctors who are already in one of the telehealth platforms. So we have a lot of friends. So we are going to get a lot of doctors in the next 1 month or so that we should be able to provide care anywhere in the world. Our goal is within 1 year, we should be able to provide care from any doctor, anywhere, any patient, any part of the world should be able to contact a doctor in any other country.
Yeah, and Monica asked the question, can you please pin details of your website here? Thank you. I will do that, Monica. After the show, we will provide that feedback, the information. But again, to say it is eGlobalDoctors.com. That is the website. And on the website, you will see the link to basically fill up the information and join Zoom. Very, very easy. I had joined few days back. Krish had sent me the information. It was amazing. I was watching the doctors in action and the patients in India in the hospital interacting with you guys, and how you were managing different language, like the people with Telugu or people Hindi, people coming from Madras speaking Tamil. They're all finding the right people. You guys were doing amazing matching so that people can be talking in their local languages there.
Yeah, I would like to thank my volunteer team and the volunteer doctors team. They've done a wonderful job. We have 200 volunteers, and one is Dr. Ganesh is they're getting all the doctors training every day and then making the changes in the form as we go by. This is all work in progress, which they think about it, and we are expanding to the daytime also, because there are some hospitalist doctors wanted to contact during the daytime, and then there are a lot of people without the smartphone. So what we're doing is we're going by phone too, so that we can help. There are a lot of smartphone people. They can get help from a lot of people, but I think we want to help that vendor, small, the street side vendor who has a phone but doesn't have a smartphone, should be able to contact one of the doctors and be able to get that help. So that's what we have started to do now, to go to the next level, so that we can contact, even with the phone alone, doctor can answer the questions.
Yeah, and मैं सुनने वालों को देखने वालों को बता दूं कि in the coming weeks we'll work with Krish also to do the actual live demonstration of the platform, and also go through some more details about eGlobalDoctors, because Krish, we are getting questions not only like how patients can be in touch with you, also how doctors can be in touch with you, right? The people who want to serve and want to be part of the team to serve, how can they get in touch with you? So we'll find a way to get those things connected.
I'm getting a lot of emails from doctors, and forget about providing services to the patients. They are ready to do volunteer work. They're ready to help in whatever the way they want to do it. They're ready for that. So that's a great response we're getting. And also, I would like to talk about Health Passport, what Dr. Srini was talking about. If you remember, Dr. Narendra Modi ji, our Prime Minister, has been talking about Health Passport in India for last 2 years, where every Indian citizen should have a health passport, so that you can travel from Mumbai to Delhi or Hyderabad, Bangalore, wherever you're traveling. If some medical emergency happens to you, then the local hospital should be able to track your medical details from that person and then provide the next medical services. I would like to let you know that we have already built it. It is a working module, and that India can take a lot of advantages of this. Every Indian citizen should take advantage of this particular initiative. Not only India, we're trying to provide services to India. We are getting response from Nepal, Bangladesh. Even those citizens are asking for, can you do similar services in their country? Right now, we are only focusing on India. Only Indian citizens will be getting free COVID-19 counseling from our doctors.
Perfect. Ritu, any other questions from you?
No, I'm just learning all the information. It's sounding so good to be true. कि ऐसा कोई है platform जहाँ पर कि especially I always worry about the people जिनको इंडिया में कोई help नहीं है, family नहीं है. But if they have a phone and this information you are giving, they can get in touch and can get the medical help.
Yeah, I've seen people walking on the road and they're calling from, when they open the video, people are literally walking on the road and they're calling from there. That's amazing, So
Wow, you
Wow.
guys are
Yeah.
There are some people coming every day. So I have one guy,
Yeah.
he lives in Mumbai, his parents are in Delhi, both have COVID. So he comes on every day. He says, oh, where is Dr. Srini? So we just talk every day for 10 minutes. Okay, what is your mom doing? What's the dad doing? What is saturation? That's all he needs. He just wants some comfort that,
yeah,
they're so good,
yeah.
they don't need to go to the hospital. So that's all I think. I think he comes in literally every day. Well, one day I was in a meeting, the host called me and said, hey, this guy is waiting for you. Can you come on? So once I finished the meeting, I had to go back join so that I can talk to him. But it's just a really gratifying experience. I think, it's like amazing.
It is.
Yeah, that assurance that everything will be fine. अगर ये डॉक्टर बोलता है कोई तो वो सुन के लगता है कि हाँ सब कुछ ठीक हो जाएगा. So you guys are doing that too.
Yeah.
Yeah.
And
So
that
thank you.
counts a lot.
Yeah.
Yeah.
Because I think it's more mental game than the physical game. So if somebody is assuring you and reassuring you, which you guys are doing, so that's super awesome.
Yeah.
Thank you, doctors.
Yeah.
You're doing an awesome job.
It's also,
I will also give you the featured offers our product. I'll just briefly go through the features what we are giving, which is not available outside in the market. Especially, let's say now a patient goes into a hospital, right, and his family members, whatever reasons they are in the ICU, and if they need if they want to have a multi-specialty second opinion, right? Most of the time, patients are trying to talk to multiple doctors at the same time. That features are not available right now. Manually, right now, you have to go talk to one doctor, talk to the other doctors, and do it. We're trying to get multi-specialty consultants from all over the world on a single platform. That is the most specialty of our product. We have well-trained, board-certified, and experienced and well-respected physicians in the medical community. All the doctors you see most of them are board-certified. Health passport, what Dr. Srini has already mentioned, and family members can participate live via video physician consultation from any part of the world. It doesn't matter wherever you are, wherever your family members can be. You all can come on the same platform, talk to the same physician at the same time. That gives a lot of relief as a family. If you're in US, you don't have to travel all the way to India and then take your mom or your dad to a doctor. You can sit here, plan properly, make your decisions, and then do a traveling to India or whatever decision you want to take. That's the best way of doing it. So, yeah, and a lot of other features which I'll let you know later on.
Wow, this is amazing. Thank you so much, Krish, for joining, Dr. Srini for joining, and Red for joining. You guys are doing, and Srini, as you were saying, drop in a bucket, but I think your drops are not in the bucket, but it's in the ocean. It's every drop is in that ocean of humanity, of being angelic people that you are, spending the time. I know millions and millions of blessings will be coming your way, Krish, for eGlobalDoctors, and we will do everything to help spread the word so that people can utilize the platform during these hard times. So thank you so much for coming on the show. Really appreciate it.
Thank you, Rajiv.
Thank you. Take care.
Thank you very much. Bye.
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 Bye, everyone.
Bye. Ritu, it's amazing, right? It's so.
Yeah, it is. मुझे तो ज़्यादा पता ही नहीं था. अभी मैं पता चल रहा है कि